Hey, Dr. Islam here. So how can ketamine be beneficial for patients with different diseases such as PTSD, anxiety, depression, treatment-resistant depression, suicidal ideations, RDS, CRPS? So how this typically works is something called through BDNF, so brain-derived neurotrophic factor, and what it does is actually causes the brain to refire and rewire, okay? That being said, typically in clinic, we typically do IVs or IM injections, and then at home, you're able to do what are called like troches, which are like little lozenges you put underneath the tongue, and nasal sprays, okay? Usually for pain patients, I typically tell them you're going to go more along the IV route, though patients do still get a benefit out of the troches, but you can get a lot more of a milligram dosage with IV injections. That being said, as far as with the troches, these are nice in the regard that patients don't have to come into the clinic, and they can easily do it at their home 2 to 3 times a week, and they just keep it under their tongue for about like 15 to about 20, 25, 30 minutes, okay? That being said, nasal sprays I typically recommend more for when you're doing when you have some sort of acute symptoms, so like a breakthrough of something, breakthrough of like some panic attacks or whatnot. You just do a couple of puffs or sprays. Now these are typically used off-label, when we use it for patients in clinic, but a lot of patients get a lot of benefit out of it. I'd say, like, from my patient basis, patients who do the at-home treatments, especially for any psychiatric issues or whatnot, I see about a 90% patient improvement in general. So I say 9 out of 10 patients in general, they notice a marked improvement. Now, as far as just like improvement in general, I'd say that's about like a 95%. Hope this is helpful, Dr. Islam.